Morning, everybody. Just wanted to take a minute and let you know that WRCM, Wisconsin Rapids Community Media, is doing a great job. Joe and Taylor getting us set up in a position where we can start doing podcasts. The reason I asked them to move forward with this, obviously, it's a new way of spreading information and getting information to you guys in the community faster, and know that it's coming from us who are working in the government to provide your services, so you can get a good understanding of what we're doing, why we're doing it, who we are, so you can understand that we're just local people like you guys that are being asked to do jobs in the government to provide the services that we need as a community so we can function well. So again, we appreciate you taking the time to listen and learn that information, and always feel free to reach out to us at the city, and make sure if you have questions that we can't answer, that we do answer them and get you that information as quick as possible. So this morning, I'm here with Ben Goodreau, who is the new fire chief for the fire department, and just wanted to go through some things that are on our agenda right now in terms of what we're working on together as the fire department and as a city. So welcome, Ben.
Thanks. Yeah, thanks for having me on. I hear that this is our first podcast with the City of Wisconsin Rapids, so I'm excited that you selected the fire department and myself to have a discussion today, and hopefully we can get into the weeds a little bit, as we normally do on some of these issues, and discuss what it is that the fire department not only offers our community and local public safety systems, but also what we're doing as a city level and leaders from our organizations and you as the mayor, as we look forward to the future and setting up a system that is there for our community.
Yeah, it's great. Again, thanks for being here. Also, I would just wanted to extend a thank you for being a part of the community. You live in Wisconsin Rapids. Can you share a little bit of your background, where you came from, how you got here, and family and all that?
Yeah, so unlike the job market today, it was highly competitive 20 years ago when I was looking for a job in the fire service. Right out of high school, I was a graduate of Fox Valley Tech for the fire protection program. I got into firefighting, just had a compassion for people, really wanted to help in the community and be involved in the community. So that's kind of what led me to the profession. Once I got done with fire school, I realized that a lot of municipalities were taking on EMS, so emergency medical services and ambulance work. And with that, I got involved with EMS and got my paramedic degree as well. I really enjoyed the science side of things, and I was born and raised in Green Bay. The competitive market, finding a public safety job, led me across the state to many different interview processes, and Wisconsin Rapids was the first one to offer me a job. Shortly after Green Bay offered me a job, I had to turn that down and say, I got to be loyal to those who provided me an opportunity first. So that's what landed me in Wisconsin Rapids 20 years ago. Fast forward today. I just got appointed in January as the fire chief of the Wisconsin Rapids Fire Department. And from here, you and I kind of met through many different avenues, and we're continuing to work on things now as a collaborative approach.
What, again, I've been on council for 3 years before this. It's actually 11 months now, so almost a year in the mayor's seat. Somewhere along the way, we had voted to change the living situation, where you used to have to live in Wisconsin Rapids, then it was within a 30-mile radius. And then recently we voted to not have any restriction on that. And we could go into that a little bit, but again, the point I was making, or reason I was bringing it up, is you, of your own free will, have always, since you've been up here, I don't know if always, but you live in the city limits of Wisconsin Rapids. And again, it's not something you have to do. Personally, I would not want to vote on making it mandatory to live in the city limits, but what I do want to do is build a city that everybody wants to live in, that works for the city because they take pride in the job they're doing, and knowing that everything they do benefits the community that they actually live in, serve, and pay taxes to. That being said, can you talk a little bit about, your decisions to live within the limits and what you've learned about that? And
yeah, great. And I agree with you. Living in our community and serving the same community, as a first responder, firefighter, paramedic, I grew up, the last 20 years, growing a family, a wife. I got 2 kids. We live just north of the hospital there. Really great neighborhood. What was great about growing up in the community that I'm serving here over the last 20 years was I got to be involved in different facets of the community. So unlike some of my colleagues who live outside of the city, they don't have the same privilege I do of being involved in the community in ways that offered me different boards to sit on. So for a while, I sat on the ethics board. I was appointed by Shane Blazer and yourself to the Planning Commission. I gained a lot of experience and insight in different perspectives about what's happening in our community in different ways that not a lot of people from outside the community can be engaged with. So being a part of the community was really a passion of mine because you would see certain problems or issues that could require fixing, and different perspectives from that approach, being a city worker as well, really offered, the privilege that I had and the city to mutually benefit from that. So I really enjoyed living here throughout the 20 years. The community, walking distance to a lot of the things, going back to Mayor, Verwink and the expansion of some of the trail systems. I saw you and your wife out on the trail the other day with walking dogs. It's like that. My wife and I leave our house all the time and walk along the river. It's just a beautiful environment to get away from, the chaos of work and whatever it be, and go down there and have a walk every night almost. So, this community really affords, although it may be a little bit quieter than some other bustling communities, it really offers that ability, to raise a family, the safety net of our public safety systems, and then everything that the city's looking to do to expand into services for families like ours.
Yeah. I don't think I realized, Jenny and I lived in Milwaukee, and that's where we started our family. We had Martin down there. We moved up here, and he was 1, and Lydia was on her way. Now we have Simon and Vivian also. But I don't think I knew. I was 31 years old, just out of military, right into college. So I don't know if I really didn't know what it was going to take to raise a family. And everybody knows, like, it's beautiful, but it's scary. I mean, there's things that you just don't know until you're in the middle of it, and then it's like just kind of keep swimming and figure it out as you go along. And but I to know now that we moved to Rapids, kind of because of housing, kind of because we were in Milwaukee, and I love Milwaukee, but we were raising a family. So the decision we made back then 20 years ago was a great decision. I love the community, and I agree with you that it's kind of during COVID that I said, I don't want to be part of the problem. If I have gripes, I want to know what I'm actually complaining about, and know, the reality behind the scenes of what's happening. And that's why I chose to run at that time. And 4 years later, I'm kind of really diving in, because even as alderman, I didn't necessarily get the big picture behind what's going on behind the scenes, and really communicating with everybody and the city, the residents of businesses themselves. So it's been great, and Wisconsin Rapids is great. It's great with the trails to be able to walk and the amenities that we have. And, again, it's up to us. And again, that's why I'm encouraging as the mayor, everybody, like, entrepreneurial, like, open your business, like, make this your home, figure out how business works and grow, because that's the only way we as a community grow is by the people doing it. The government can't do it. Our job is to just make sure we have a safe community to live in, and provide the necessary services to make that function. And it's kind of neat because most people don't realize just how much work we're doing behind the scenes to make that society function the way it does, or that community the way it does. And I appreciate everybody that's in it.
Yeah. I think you bring up a really important point too, is that you got involved because you wanted to not only understand it, but fix some of the problems. And I think half the battle is things like this, right? We're getting information out there, educating the public, because a lot of the decisions that we make are, competing goods or whatever it be. And we're all competing for the same services or scarce resources. Right. So I say a little muddy. We're trying to say, hey, this is the avenue we're going to go. And, we looked at all these different things, but, to approach it from an educated standpoint, I mean, so often you can go on Facebook and, everybody's got an answer for everything, right? Oh, why don't you do this? Why don't you do that? But until you really dive into the weeds like yourself, who got involved in the community, government, you realize that the problems are a lot more complex than one simple answer.
Right. Right. No, and speaking of that, Chief Eckes was cordial enough to allow me to come into the fire department for a week. I slept over one night. I did not sleep over for the whole week, but I spent as much time as I could there for the whole week. I mean, it was a lot. It was a lot. Not to mention, I was just mayor for a couple of days, I think, at that point. So, but it was important for me to jump in and meet everybody that was there to just get a sense, because it's easy to sit in a bubble or sit on the third floor at City Hall and try to make decisions or understand or think you understand. So again, I guess it came down to just to get a slight understanding. And I don't compare that to what you and all the men and women at the fire department understand on a day-to-day basis, and how impactful the decisions you're making and the choices you make and the life you lead every day impact our community. But it did give me a better understanding of who they are, how the day functions, what the calls are like. And again, it's a small sampling of the big picture of, because ultimately what I want to bring up here is the fact that the big battle that we're fighting it impacts the fire side, the fire department side, but it's really the EMS side that we're up to somewhere in the ballpark of 5,000 calls a year. And I'll let you kind of talk more about like how many ambulances we have that are serving and kind of how the people work without going too far into the weeds and confusing everybody. But I think if you could give a decent breakdown as to the services and what they look like between machinery and people.
Yeah. So right now, Wisconsin Rapids Fire Department has 36 members that serve our blind staff, it's called. And then we had 3 administrative positions, myself included. We have a division chief of our EMS that kind of handles that pillar of our business. And then we have a division chief, which is also our deputy chief of fire. And he handles kind of the fire side of things. And then whenever I'm, not present at the station, he takes command of that. On a daily basis, we run 5,000 calls. Last year we did. That's up about 9.5% since the year prior. EMS side of things, obviously we provided ALS or what's called an advanced life support ambulance. We have 3 different areas or service areas that we respond to. So there's the city of Wisconsin Rapids, and then we have our O-line areas, and we kind of break those up strategically so those 3 ALS rigs can kind of serve those areas of the community. Our daily staffing minimum is 9 personnel. So that's something that you and I have been discussing over the last, I would say 2 years, kind of looking at that threshold of, when do we potentially add different personnel to adjust and address the call volume that continues to rise? And then what can we do upstream to kind of prevent some of those emergencies that are not true emergencies? And maybe we'll talk, about some of that later in the podcast here. But that's kind of our strategic operational model that we serve our community. Obviously, EMS is just one portion of the thing that we provide our communities. We have some outlying areas due to Nakusa ambulance a few years ago. They could staff their ambulance anymore. They decided as a municipality that it was getting too expensive and they were looking for contracted EMS services. They approached the city at that time. That was before you and I were administratively in our positions, and signed a contract with us, including Saratoga, Port Edwards, the casino out in the Ho-Chunk Nation, and then Buren municipality as well. So those are the areas that we serve EMS for, and then we just do fire for the city of Wisconsin Rapids. I'm really passionate about building our mutual aid partnership with different agencies around, like our fire departments in Grand Rapids, Port Edwards, Nakusa, and up in Buren, and we have a really good working relationship with them. We've built that up over the last 5 years. So if they have something, a large incident, or we have something in the city, there is that mutual aid. So that's why you might see, a fire truck from, say, Port Edwards or Buren in the city of Wisconsin Rapids, or you might see one of our rigs down in those other municipalities too, because we have a really good working relationship and go down and help them, or they'll come into the city and help us. That's kind of an overview, very brief one of, our operational model and what we what a daily, shift looks like on our end. Our personnel show up at 7 a.m. and they're there for 2 days. So we have a 48-96 rotation, as you know. And yeah, we're busy as an organization for sure. So
I, again, was on council and voted for the ability to provide kind of mandatory, but not, I mean, you can't force anybody to talk. But I have heard, we're kind of the age where we kind of grew up in a little bit tougher, harder system. We didn't talk, we didn't have therapy, wasn't what it was now, counseling, that kind of stuff. But at the same time, we didn't have cell phones either, and I've made it halfway through my life a cell phone. So I've kind of learned, wanting to protect my family and my relationship with my wife. Like, I've had to seek out counseling just to make sure that I was doing the best I could for my family and really for everybody. If you own a business, people rely on you. And now I've talked to enough retired firemen and police personnel that have said that they wish they would have had the option, to have that as they were going through it, and because now they're dealing with it at an age where they kind of wish they, So that being said, we do have that, and again, I'm certainly not looking for specifics, but are you finding that to be helpful, and are people using it? And again, that helps offset a little bit of that, the wear and tear that the 48 can put on you also.
Yeah, I think that's kind of a great segue into, this program that we started up about 5 years ago. It's kind of a pilot program, and then it's kind of evolved over time. So, and it honestly started back with the renovation of our fire station 1. So the program or the initiative is Resilient Responder. So what can we do to invest in and ensure that our responders are ready to go for that next call, and they're 100%, when they're going out in their community. So Resilient Responder is, started, again, like I said, back when we renovated the station. So what we did is we took a look at what are our physical threats, right? Some of the physical threats to firefighters are an incredibly high rate of cancer. We're subjected to different chemicals on scene, in firefighting, the carcinogens. So what we did was we made a cancer-free or a carcinogen-free station. So we have different ways that we can get rid of the cancer and get some of that stuff off our gear. It goes right into washing machines. Our responders don't go back into our living quarters until they've showered and got everything off of them. Different clothing and stuff like that. We have completely separate laundry service. So that's one side of the physical side of things. The next side that you kind of touched on is that behavioral health. So that was really important to us too. The average person and citizen, faces a few traumatic events. They might come upon, an accident once in their life, or see something horrific, and those are really tough things to absorb without proper help. But, our responders are going out on these events, multiple times a year and facing these horrible incidences within our community as they help our citizens. So we try to look at what can we do to set up a pathway for successfully manage these incidences where maybe they don't want to talk about it with anyone else. You and I could have a conversation because I feel comfortable talking to you about it, but back at the station, maybe they don't feel like opening up. And there always has been the stigma in public safety, police and fire, about, it was always not okay to not be okay. So that stigma is starting to lower with some education. But as a city, and you were on council when we approached council about that, and we had resounding approval to go forward with it. But we started a pilot program last year, which was our behavioral health program. It was called Checkup from the Neck Up. And instead of a physical that we're doing on all of our people, taking blood, everything else, you're sitting down with a licensed clinical provider, and you're just doing, I think they go over like a checklist of like 9 different things, different stressors. And maybe it's related to the job and maybe it's not. But we found that people, when they show up to the job, if they're carrying other things, stressors from home, whatever that we might be dealing with, in their personal lives, that carries over, and, it suffers in our ability to respond to our community. So if we can handle some of those things and provide individuals with assistance, or if they are involved in a traumatic call, and that's going to, inhibit their ability to come back tomorrow and be a resilient responder, then that's something that we want to provide them, because we really have to take care of our responders if we're going to have a good fire department. Right.
No, I think I kind of live by a philosophy like we're on this earth to be with our families, like to live our lives. Like, I think sometimes it's tricky in America because it's work, work, work. Try to get ahead, try to do the best you can. But in the end, if you really stop and look at the big picture, the only legacy, the only people that are going to really remember you are the people that you raised to raise other people, and then you have your family. And so I do believe that we're on this earth. We're here to work so that we can live our lives, not live our lives to work. So the more people we can help that are doing tough jobs, and have the ability or are susceptible to bringing that pain and that hurt or traumas home, and kind of setting that on a trajectory that isn't good for the future of them, their family, and everybody down the line. So whatever we can do to help that, I think, is very important. And I can't imagine anybody would say no to that. So I'm glad to hear that it's helping and it's working. And hopefully if more people can take that up and move forward with it.
Yeah. And that's just a pathway for, a help. It's not, cure all. So the individuals still, as we all have witnessed, the individuals have to kind of take some of that work on themselves and do it if they're willing to, and they're in their right spot. But I think you hit on a big thing is like in our industry, we might suffer, physically or mentally on, a really bad call. But then, like you said, we bring that back home, and then how does that impact our family? So that's that holistic look that we are looking at from that resilient responder approach is, make sure that we're taking care of our responders, because eventually that leaks back to the families. And that's even not something that we want to leave them with to us.
Absolutely. Going back to diving in a little bit deeper on the call volume, looking at, I'm just going to say 5,000, even though I know it's, where it's 4,950. So what are some factors? I have my own, and I know we kind of go back and forth on this a little bit, but that call volume is what I'm asking you to understand from my perspective as the mayor of the whole city and all the departments versus just one department. If we can figure out the call volume and focus on call volume, and I realize in the meantime, we have to service the call volume as it is, but then looking 2, 5, 10, 25 years down the road, if this doesn't, if we don't do anything to address the call volume and it only continue, either stay the same or increase, what are some of the factors that are impacting that call volume to get it to this point right now? I've heard, we talked, you said, and I know it's not an easy number to come to, but 30% are non-emergency. I've heard 50%, or maybe that kind of what number I had in my head, but I've also heard from the state and federal level, because this is a federal-wide problem.
Yes. Yeah.
That it's more like 70% that the calls that are being brought to, called into the EMS, where we're sending out our highest trained and paid paramedic and firemen, they're being sent out on calls that are not emergency calls. Can you speak a little bit to what that all entails?
Yeah. So, I'm being told on a state level, and we discussed this with a gentleman that came up to meet with you and I, James Small from the state. And so we're looking at all avenues, you and I and the city, at addressing these problems. But one in 6 calls are, say, related to falls or just lift assists, we call it. And those are individuals that just fell on the floor at home. They don't have anybody else. Family isn't local, and they just can't get up themselves. Obviously, it sounds like a benign and non-emergent call, but some of those do lead to the highest mortality rate in Wisconsin for those that are above the age of 65. So I think it's always difficult, right, when we look at what is an emergency to you and me compared to what is an emergency to the rest of our public. So, defining that, like you had said, it is very gray area, whether it's 1 in 6 or it's 30% or 50 or greater. It's always difficult to define what an emergency is. But one of the things that you and I have talked about quite a bit, and you have a social work background, is connecting those individuals with the services that are appropriate for them. Because although we're willing to respond to those, we respond to the 911 call that somebody says they're having an emergency. But when we get on scene, there's that education piece, and sometimes we're only able to do it with that one-on-one. Whereas, here we have, a platform that we can, educate the community on, what is their actual need for service. Is it an emergency room? Likely it's not in many of those cases. They might get connected to, say, the ADRC or some other county service. But a lot of times in an emergency setting, our only option is hopefully to connect them with that service if they, require it, or we transport to the emergency room, and that's not always appropriate either. One of the things that the police department is doing is they got that legacy grant, and they have a co-responder, so a social worker, for sometimes more of the mental health things. But I think we're looking at Chief Hoskins and I about pairing up with that individual and maybe expanding that program into the EMS side of things so they can correspond with our responders on those non-emergent calls that require more services that are not emergency in nature. And so hopefully we're able to leverage that position into something more than just what the police department is using it for this year. And I know it's a pilot through a grant they got through Legacy, but I think that would offer the ability to work upstream on some of these patients that are frequent to call me. And when I say frequently calling, I think, the highest call rate was over 40 calls from one person in a month. So you look at, like you had said, the call volume exponentially rising. We have a call volume and urgent need for many of these people to get EMS services, but we have a disconnect between, a few of them that just need services that have not been able to connect with them yet. So hopefully we're able to bridge that gap, and that'll kind of either plateau or bring that call volume down. But yeah, we're kind of in a pinch point right now, as we discussed.
Yeah. So I think a bigger part of that issue that I'm understanding is we're at I don't know if we're at the very top of the bell curve when it comes to the baby boom generation, and the amount of people that are in that generation that are actually at home now. Or so, a fair amount of them go to, like a facility where they're more in a community, but a lot of people actually stay in their house and they don't have family. They don't necessarily have the friends that they used to have if they're still around. So they're kind of doing their own care at home, and eventually they can't. And a lot of times then it reverts to the 911 call as their home health care to some degree. Can you speak a little bit to the system that's in place with the 911 system and how that works in terms of how, liability wise and like response wise? Like once somebody makes the call to 911, what's the...
Yeah. So once they make a call to 911 and it's a emergency medical system that's alerted, so not fire or anything else related, somebody's in their house, they're stating that they have a medical emergency, dispatch, they'll do their best job to kind of triage it. It's called an Alpha Bravo Charlie Delta system, and it kind of triages as Alpha is the most benign sounding. It checks all the boxes for something that would be, pseudo non-emergent, but we're still going to respond. Maybe we respond non-lights and sirens. So you might see us driving to their, we're getting out of the doors and in a respectable time frame, and then getting to that person's house. Whereas a Delta call could be something like it doesn't have a pulse, or they were involved in a really bad motor vehicle accident. Now we're going to obviously be very exponential getting to that scene quicker. But so when we're referring to these more non-emergent or benign calls, a lot of that takes place is, like you had stated, somebody gets into a situation where, they should have gone to see their primary care provider, but they're utilizing the 911 system as their primary care provider. One thing that we see that's unique to our community in that sense is our Medicare and Medicaid clientele that are calling are nearly 80%, whereas the national average between communities using EMS is below 50%. So I think that's the one piece of our system that's unique compared to other communities, is that high rate of Medicare and Medicaid using that. And that could be individuals older than 65 or people on other assistance programs that just aren't able to,
provide, a primary care provider and go and see one. So they're utilizing that emergency medical system as their primary care providers.
Yeah, it's an interesting part of that. So once they call in and ultimately if they're calling 911, we are responding. Yeah. We have to liability, same with the county who handles the call, the 911 calls coming in and sends it out. And for better for worse, we're right now a society country run by lawyers and insurance companies. So we're all worried about, we got to do the right thing so we don't get sued and we don't do the. So that puts us in an interesting situation because, well, we're going to respond. But then to your point, what do we do once we're there and we meet the person and we see what's happening? What are the resources that can be connected? Who's the person? If you have a paramedic there and they check this person out and medically they're fine, everything's okay, they're staying there. This is what you and I are talking about right now is what within the confines of legal and liability wise, insurance wise, can we set these folks up that probably could be in some kind of an assisted living place at this point, but they don't choose to go there.
Yeah.
So it's putting the burden on us now as a municipality to say, well, what can we do to help them besides just getting more and more paramedic firemen because that's our system right now. We'll talk a little bit about that in a minute. But that's our system right now. So instead of burning out and taxing these folks that are here for the major emergency stuff, for all the smaller stuff, how do we design a program between what we have as a city, what the county services have at their health and human services, aging and disability. There's private entities that are, here in town that actually do these specific services. Yeah. There's churches, Love Inc. is in town. It's connected to every other church, I believe, that wants to be a part of that network with volunteers that are helping that want to help their neighbors, with good intention. Again, making sure that they're vetted properly so that the insurance kicks in. But all these different parts to solving a problem that we're facing. And right now the choice is to continue to build. And I know temporarily we're going to have to do something to cover the call volume more efficiently, more effectively. But ultimately looking, 25, 30 years ahead, how do we set up a program that's actually addressing the needs versus, something that.
Yeah. And I think you kind of hit on a couple of them, a couple of the different services that are locally that we look at for those resources. We paired up with the ADRC for a falls prevention program. We were actually the first EMS agency, I believe, in central Wisconsin that paired up with them. And what we have there is, a fall prevention program. So the individual that might fall, call 911, needs help up. Our providers will come do an assessment. That individual maybe doesn't need to go to the emergency room. They've identified that. But then they'll enter them into a program as long as they're willing, where the ADRC can follow up with them. They'll do a home inspection. It's not necessarily a home inspection, but it's more of a safety inspection on what we can do to prevent that person from falling again. And they'll really take the time. But again, that individual has to be willing to accept services from the ADRC. When you were talking about, maybe the need for that person to go into an assisted living, there's a lot of, a threat to someone's, independence, especially as they age and they want to stay in their house. So that's something that we really have to look at, and we've identified as responders is, where is that gray area that, maybe you should be going into an assisted living, or, if we can connect you with a couple of these services and you're willing to work with them, say 2 times a week, 3 times a week, maybe it will keep you in your house longer and have, that independence longer, and you just need some services to get connected with. So I think when we are out and we're dealing with the community in those situations, we encourage people to accept the services that are there through the county, through the ADRC and stuff like that, because I think there's a fear behind those individuals coming in and saying you have to learn at home, and that's not necessarily what they're there for.
And I don't agree with that either. Like the autonomy of human, they made it this far. They're a tough generation. They don't want to, lose that autonomy and that freedom. But again, if you're taxing, the rest of the community system because of that, again, that's where we got to find the balance of. So, So moving into the next one, I just had a few other clarifying questions, I suppose. Working with the outlying communities, and we do have, United Healthcare out there. That's another ambulance system that services some of the communities, and kind of what that looks like, because it was new to me again on the board. We had just got on and we voted to.
So it was contracts.
Well, the first we actually voted to fund the rebuilding of the East Side Fire Department with the upgrade to the West Side, and that was my
Inaugural.
yeah, that was my baptism by fire kind of thing. No pun intended, I guess. But yeah, it was interesting, and I'm glad, having spent that week there, getting to know that facility, getting to know the West Side a little bit. I think it was important because Rapids isn't going anywhere. It's changing. We're changing from a mill economy to a more entrepreneurial economy. I'm glad to be a part of that conversation and help. But ultimately, the community itself is going to change, but it's still going to be here. So we're still going to need fire. We're still going to need EMS, whatever that looks like at that time. So we needed to invest in those buildings. Yeah. And what we did there, I think, is really great. And they're open. I mean, if people want to come by, I was encouraged. But yeah, you guys.
Yeah, it's a great place. Like Mayor had said, we have a state-of-the-art training facility that we have now. And it's all at our East Side fire station, which is really important to us. Geographically, it's a perfect location, 12th and the expressway. And houses typically 6 or 7 firefighter paramedics, including our admin staff there. So anytime anybody wants to stop by, I think there was a tour this morning for St. Luke's that came by, a bunch of kids, and toured our station. But otherwise, we have events that we hold quite frequently there. We have a cadet program. So if individuals from that high school age are interested in, and that was one of our little topics that we were talking about too, but I'll just kind of plug that too, is if we have some high school age kids that are interested and they don't know if they want to be in public safety or not, we have a 12-month program. It's just one night a month that they come by and they can experience and go through kind of a training program that we have. They can get on some of the gear, they can see some of the EMS equipment and see what it is to, live at a fire station. So that's a huge thing at that East Side Fire Station that we offer every month too. So we also host our EMR groups, our emergency medical responders. So we have the EMS paramedics that go out in the ambulances, but a lot of these surrounding communities support us with first responders. So they're a lower level of EMS care, but they're the ones that are typically serving their communities out there, and they're first on scene. Usually they're able to triage a patient, assist us with any other medical things and the transport. So we host that for trainings as well there too.
Yeah, quick sidebar. I'm doing more and more of this grade school outreach, or they're coming to City Hall, or I'm going to their school. I like when they come to City Hall because then they're entering in the, could be scary building, yeah, and get them to understand that it's just a building, or just people from the community, kind of do some mock, city council stuff and make it fun, but age appropriate. But I think it's important to bring the kids in and say, okay, this is a part of the community. It's not so far out there that I can never attain it. And just to have that comfort level as a kid would mean a lot as they grow up and become adults and want to serve some else.
It might spark them, something, especially middle school kids when they come through, or even some of the high school, is like they're really finding that passion, and they're really, as we know, through middle school and high school, you're really finding out more about yourself. But some of those experiences will lead to a career path in one of these things. So whether it be city government or something along the lines of public safety.
I agree. I think it helps break down to, I'm not sure where exactly it came from and how to exactly get rid of it, but the animosity between people and this whole government conspiracy stuff. And yeah, and again, nobody's perfect, but when you're just another human being and you're stepping up to fill a role and a position, and people just think by the nature of the fact that you're in that position, you're a bad person, there's conspiracies going on. And ultimately, I believe in being on good terms with everybody in the community to the best of your ability. And, sometimes it's just not in your ability to do. So I encourage people to understand that we're just people like them filling these roles. And if they want to be a part of that conversation, they got to throw their hat in the ring too. And get elected or or get the education needed to be a part of that conversation. So we certainly encourage that. And the younger we can start, the better.
Yeah. So yeah, maybe just released our annual report and you put it up on our Facebook page. I know the city's revamping their website. We're hoping that will be a part of that as Tyler and the IT crew get that up and going. But again, if you have questions about the fire department and you want to see some of the trucks or some of the men and women that serve our communities, or you just have questions about, our annual report or what it is we do. Funny story. There was a couple of years ago, we were fighting a house fire. We got somebody out and they required EMS services. So we got them in the ambulance, treated them. And when we're getting to the hospital after treating this individual for some smoke inhalation, we're walking down the corridor into the emergency room. And, there's a physician there, the ER doctor that we see all the time. They know us very well, do some training and stuff like that with us. We're walking down the hallway, the corridor, and we have our bunker gears on because we had just pulled this gentleman out of the fire. And he said, "Oh, you guys are firefighters?" And we said, "Well, we're firefighters and paramedics." "Oh, wow, I didn't even realize that you crossed over." So there's a lot of, disconnect. And if we don't get out there and let our community know what services we have at the Wisconsin Rapids Fire Department, there's a big disconnect that can occur with this information.
Yeah. I guess at this point I'd put let everybody know like the amount of respect that I have for the men and women to do public service, fire, EMS, police. Say that the bravery to do the things that most people won't do and put themselves in harm's way to help people that a lot of times they don't even know, to have the compassion for the people that, aren't in the in an emergency situation, but they just need somebody to talk to or open a window or just be there. And they're patient and calm and willing to do that, until we can help find some better solutions. But in the meantime, they're providing services that they weren't trained to do, but as human beings, they're doing it. And it's pretty amazing, the people that we had doing that. So for that, thank you to you for doing it. You've been doing it for 20 years here and longer than that, statewide, and, the folks that you're leading now and all the positions you've carried since then. I appreciate that. Thank you, Rip.
Yeah, we got a great department, great men and women. Like I said, I couldn't imagine leading a better organization. So again, if you're interested in the fire department or what we do down there, I encourage anybody to stop by and have a conversation with me or my staff and see some of the equipment, because this is your fire department, real. Yeah.
It seems to me like this is kind of a natural place to kind of see how our first podcast goes and plays out. I don't want to go too long and get too far into the weeds. I think the only thing I want to throw out there yet is that, as we talk about those outlying areas, I have taken the time to meet with the leadership from the different communities, and everybody's very willing to sit at the table. I'm all about information sharing and transparency. I think it's important, especially even though we have boundaries because of, Wisconsin Rapids as a municipality, or I should say a city, we got villages, we have towns. It just kind of grew up that way. But ultimately, we're all in the same community together. And whatever that looks like, we have to be able to communicate, build those bridges. I was told a lot about bad blood between the Wisconsin Rapids and the other cities, bad blood between departments and the mayor, and the city council. I'm not sensing that. I work hard to try to build those bridges and just hear people out and come at it from where they're coming to. I think with this EMS services, the more we can talk as a community as a whole to kind of make it transparent and say, okay, ultimately it started out as, well, Wisconsin, in my understanding, Wisconsin Rapids is funding their fire department /EMS. And it's very difficult to, we've worked this a couple of different ways and talked about it, how you slash the funding between what would it take to run just the fire department so that you can kind of separate EMS services as an entity unto itself, so that if you're servicing a broader area, you can understand better the finances behind it to make it more fair all the way around. Because ultimately, you can't necessarily say, well, we'll just allow the Wisconsin Rapids citizens to fund the services for all the outlying areas, because as Amelia, it's not fair. And I think everybody gets that, as long as it's talked about in a way that is respectful, presentable. Yeah, to have that bigger, tougher conversation. But then when you come to the decisions, you're coming to them together with the same information, and everybody can see. But you can also plan out 20 years or whatever, what does it look like? So,
and I think you talked about that too, is like, bringing to the table the transparency of the numbers and, what does it cost the citizens of Wisconsin Rapids to hold our fire and EMS together? And if we're to assist and be a part of this community model, which we've decided, and our leaders before us have decided that, we're going to be good stewards of our area and provide that EMS service, because there really wasn't anybody else stepping into that role at the time. And so now we're here, but, how do we move forward together?
Yeah. And the biggest, it's expensive.
Yeah.
It's really expensive. Yeah. And that's the key to it all. And we have some great, community leadership and great fire departments and EMS people that are doing it. So we're going to figure this out. Yeah, I think it's going to be good. I am learning that there's never one problem and then solution, easy solution.
Yeah, it was talked about that before. Everybody always wants to throw one solution at the problem. Why don't you guys just do this? And it's like, well, there's some trade-offs then, and we want to look at that model and see what it looks like holistically and move forward with the best, not just, the one that we thought of overnight.
Well, it's tricky because the council, has a lot of obviously final say and but ultimately when we bring it to them, we're saying, this is our solution right now. We've yes or no. Oh, yeah, we both have more down options.
Yeah, that always seems like a pressure cooker. Yeah, it's unnecessary. It's, we've kind of gone through these back channels and had discussions, and I know you've met with, and I commend you for meeting with all of our outlying areas and, and sharing some of those challenges that we're having as a city, but then also coming down to our department for a week, like you had said. And yeah, that's only a week, but that's a great cross section. And never before have we had a elected official come down and spend that much time understanding what it is the fire department does. So I feel very confident that we'll, me as a team, think of a solution. You understand your side of, your work, and I understand mine, but we're going to go together as, two professionals with an idea rather than, one person not knowing the other side, of the table. So
yeah, I appreciate the work ethic and the ethics that you bring to the table, all the other work. You spend time being a part of the broader conversation so that you understand more about what's going on in the community besides just, even though it's very important. And I know the folks at the fire department rely on you to make those decisions. I guess to
Rich, I'm a part of the bigger mob. Yeah, and that's exactly the entire city. So
I appreciate
we're all going after the same competitive limited resources.
That's the hard part. But ultimately knowing that, and this is more maybe just understanding building the business that we built the last 20 years, there's no decision that's final. You make a decision so you can move forward instead of being paralyzed. And then you decide, okay, this is working, this isn't, adjust accordingly. Yeah. You can do that within the city too. And again, that's where communication and transparency comes from. Hey, we need to shift a little bit. And if you got to bring the council in to make, stuff like how big does the decision have to be made before you bring them in, or just inform them of what's going on, try to inform the public so they don't feel like we're just doing what we want willy-nilly. But at the same time, it's a municipal corporation, and you have to be able to be nimble enough, agile enough to kind of move accordingly to make things right and adjust well. So yeah. Again, thank you for your time. I appreciate you coming.
Yeah. Hopefully this was a good first podcast. I thought maybe Dan Hastas, the police chief, will get on next. But some of these challenges on the public safety side, that would be a great one. And you can expand in onto that co-responders. I think it was something that he had spearheaded down in Illinois. He had it too. So
yeah, but he brings a nice a new perspective, and change is hard for a lot of people. That's always the tricky part, especially in governments, because I don't mean this in a negative way, but status quo is much easier than, trying to figure out the changes and then go with them and shoot for the stars. And right now, everything's changing, and if we don't change with it, we're going to be left behind, and it's going to be much more painful in the long run. So the more I can help be a part of that process is great. And thank you again for doing that. Thank you, Joe and Taylor, for being doing what you're doing here and being flexible enough to help us kind of get this started and see how it goes. Now the key is getting it out to 40,000 people in our community and spread the word so that we can get feedback from you guys as to to what you want to hear about and go from there. Yeah.
So sounds good.
I guess thank you. Yeah.